Hi, it's Tawni Peterson, nurse practitioner from Adams County Health Center.
And Rio Peterson, I'm a registered nurse.
Today we're going to talk about COVID testing.
So, what is the importance of COVID testing? Let's say that you test positive. What does that do for you? Unless you have underlying health conditions or are taking medications, likely not much. In those cases, it might change your plan of treatment. More so, it's going to help protect others, because if you do test positive, it increases your responsibility of self-isolating. The goal here is to slow the spread of COVID. So a positive test would also lead to something called contact tracing, which everyone that you've come in contact with for the past 14 days should be notified of your positive test. That puts a greater degree of responsibility that they're also self-isolating, and it lets them know that they should maybe keep a closer eye on developing signs and symptoms of COVID. The data of testing also helps health officials and our local governments, and also federal, make decisions about the degree of social distancing measures and business shutdown that needs to be in place to help slow the spread of COVID. Health experts right now are saying that after we see 14 days of a downtrend in positive cases, that we can progressively begin to ease off of these social distancing measures that we have in place and start to return to our normal routines. The problem we're having at this point is our testing capacity is low. We need to be doing more tests. Unfortunately, there aren't enough available at this point, but it's something that in the next couple of weeks we're going to have up to the scale that we need. So the best thing that we can do is stick to our plan right now of staying at home, limiting exposing others in the community to potentially infected people with COVID. So I think that the takeaway from all this is stay at home, increased testing is coming, and Tawni will talk about that.
I think a lot of you probably heard about the 5-minute test that has been developed, and they have definitely ramped up production and they are distributing it. It is going to the high need areas first. And so by the time it reaches Idaho and we're actually able to put it to use, it may be just a little bit. I've also had people ask me if there are home tests available, and the answer to that is no. One of the things that we are seeing in our community is we are seeing a lot of just cold and flu symptoms, and some of them may mimic COVID. People are calling and asking, should I get a COVID test? What we're finding is that the guidelines to actually getting tested are really strict. And so we're doing a lot of counseling over the phone. We're seeing a lot of patients virtually. So the guidelines on actually getting a test are a temperature, a new onset temperature of 100.4 or higher, shortness of breath, and cough. The other question that may be asked is, have you been in contact with a positive COVID person? And it may even get a little bit deeper from that. Were you in close contact with that person, less than 6 feet, or for longer than 10 minutes? So you can see the guidelines are pretty strict, and that's just because we have so few tests available. All of the hospitals have screenings outside, and then from there they determine if a person is actually a candidate for a test. I know at our clinic we are doing our screening outside also. If you think that you could have contracted COVID, you do not want to call the emergency room, and you do not want to call 911. They cannot take the amount of calls that would come into them. You need to be screened, and hospitals have screening hotlines. Call your primary care provider, call your clinic's hotline and be screened. Let's see here. One of the things I wanted to say, this is information that I wanted everybody to get today, and that is that if you are home isolating, or if you're just being very responsible and social distancing, and you're finding feelings of anxiety, loneliness, you're overwhelmed, you just need support or you need someone to talk to, Idaho COVID has a hotline. I'm going to put that number in the comments below, because they wanted us to get this information out so that people can call that hotline and get the help that they need. Additionally, our clinic is open. You can find our hours of operation on our website at achcid.org. You can also call the clinic at 208-253-4242. That pretty well sums up our live presentation for today, doesn't it?
I think so. If you guys have any questions, any comments either, leave them down below and we'll get back to you.
So Monday we're going to talk about masks. There's a lot of information floating around right now about masks. Should we wear them? Should we not wear them? Where could we purchase them? Can we sew them? What type of mask do I need? So we'll talk about that on Monday.
Thank you guys. Stay home and we'll all get through this.